Hi class, I hope that you all are having a good day. I just wanted to make a short video to talk about your upcoming Practical 2 that will be performed virtually for our PCM1 course. So for our practical, you need to be able to be in an environment that's going to be well lit and allow for you to have reduced background noise that your grader can be able to see you and hear you clearly. You're also going to need to have a laptop computer so that you can be able to access your RingCentral link and to have a virtual meeting through RingCentral with your grader. Just as you would select a case, when you are logged into the RingCentral, your grader will actually share their screen and you will be given a case. You will be given time to review the case and then you will proceed through the rubric, which I'm going to show you in just a moment. You want to make sure that you are thinking about the rubric and planning ahead, and so recording yourself practicing some of the sample cases would be an excellent idea. I know for me in the past when I've done that, I felt much more comfortable with the rubric and I've been able to identify areas that I needed to go back and refresh before I had to be tested. Think about wearing proper clinical attire as well and your name badge, and if you have your white coat and want to wear that, that is completely appropriate. Once you are able to read your case and you have made your selection, then again, you're going to proceed through selecting of a device, performing a confirmation of fit, demonstrating and discussing with your patient, how you would actually perform the functional mobility pattern. And so I'm going to go through and actually show you how that would look like today. And then we can discuss it further in more detail and answer your questions this upcoming Saturday during our lab. So I have the rubric in front of me and I'm just going to go through each portion of it. I'm going to give you a sample case that would be similar to something that you might see on your upcoming practical. So my case that I have been given by my grader that will appear on my screen in the RingCentral meeting, it will state that my patient is a 65-year-old male, that he has right-sided knee pain that is resulting from osteoporosis. Otherwise, my patient is strong, 4 out of 5 strength in all extremities, has good balance, and is very active in the community and wants to remain active, but ultimate goal is to protect his right knee. My patient is looking for an assistive device and needs to be fitted for that device and also provided an appropriate functional mobility pattern. So knowing that information, I'm able to think about it, I'm able to rationalize what's going to be the best selective device and pattern for this patient. And then once I'm ready to proceed, I can just state that. Again, I would have to go through the informed consent. So as you're looking at the rubric, you're going to see the informed consent process, and that would look something like this. Hi, my name is Bonnie Mugulia, and I'm a physical therapist at the University of St. Augustine. I just wanted to confirm your name and date of birth before we get started today. With that information, I just wanted to tell you that today during this treatment, what I would like to perform is going to be selecting an appropriate assistive device for you and then showing you how to walk with it and making sure it's fit properly for you. I think that this is going to be the best for our treatment, and it's going to keep you active. It's going to protect that right knee. It's going to help you to do all the things that you want to do, and so your quality of life will be higher with this device. Again, whenever you're doing anything new, especially when you have to walk with a new device that you're not used to in a new way, that can cause you to feel a little uncoordinated and a little bit different than you have in the past. But again, I think this will be the best for you. I think it's going to help to keep you in the best health possible, reduce that pain by providing some external support and doing all the things that you enjoy doing, which again will give you that optimal high quality of life that you want to live. If you do not want to do this today, then we can of course do other exercises. We can work with strengthening exercises for your knee to be able to protect your knee. But again, I think that we should work on fitting and selecting that device and then moving into an appropriate functional mobility pattern for you. Do you have any questions for me? Is that something that you would like to continue? If so, can I have your consent to proceed? Once I have that information, I can then select the device, share with my grader my rationale, and then go through the fitting process. So for a patient who has right-sided knee pain, is strong, is active, has good balance, and is coordinated, I'm going to have something that's not going to be very restrictive. And so I'm going to use a unilateral device, and it will be a single point cane. I'm also going to think about the patterns for that device. And so being able to choose from a unilateral pattern, I would have a 4-point modified or a 2-point modified. Because my patient is active, because my patient has a good balance, because my patient is coordinated, I would be comfortable with doing the 2-point modified pattern and starting my patient with that using the single point cane. And I then would want to proceed to be able to just, maybe answer any additional question that my grader might have at that time. Otherwise, I'll just continue. Being able to perform an appropriate fitting of that device. My patient, I'm gonna need to know their height. And so I would just ask them their height and then try to fit it based off of my own height and what I am aware of my own body size to sort of pre-adjust that device for that patient. And then once it's time to actually confirm the fit, I would have my patient in a seated position. Before moving forward, I would want to make sure that my patient has a gait belt on. I would want to make sure that the seated position is secured. So if it had a chair that was not stable, I could stabilize it. If it had a lock, I could lock it. If there's anything in their pathway, I could remove it so that the environment is set up for success. If there's another surface we're going to be walking to, I can make sure that's stabilized. If it needs to be locked, then it's locked. And then I would want to perform a demonstration of sit to stand. To be able to stand up from a standard chair with a unilateral device, I need to be able to have the device positioned opposite of the affected extremity in most cases. And so for my patient with right-sided knee pain, that single point cane would be positioned on the left side. From there, I would show my patient that when you're standing up, you're going to not be able to rely on that cane to stand unless it has a supportive base, which most don't. And so you're going to have to hold on to that cane and be able to press up from the chair using your arms. Once you're in standing, you're going, and also if there's any knee pain, you can consider your feet placement. And so you might have to position the left foot slightly posterior and a little bit more towards the midline to get that better base of support and stability to stand. Once in standing position, I would then just inform my patient through this demonstration that for the fitting process, there would be 3 landmarks that I would need to assess to make sure that the fit was appropriate. And that would be at the wrist, looking at the hip, and then also at the elbow, and that I would want their permission to be able to contact them. From there, making sure that the fit is appropriate, I would, before my patient sits back down, make sure that I'm in an appropriate position and demonstrate to that patient how the sit down would look. And so reaching back once I feel the chair on the back of my legs, coming to a very slow and controlled sit, and making sure that if my knee was giving me any pain, then I could have my left foot again slightly posterior and a little bit more towards midline to give me that extra support. So after doing the demonstration, I'm ready to proceed to the actual confirmation of fit. So I'm going to stand on the affected side. My patient has a gait belt. I would have performed infection control before contacting my patient. And then I'm going to have my patient scoot forward. Once they scoot forward and their back is not against the chair, I'm going to hold onto the gait belt and place one hand on the trunk of my patient on that right side. Upon standing, I can then make sure my patient's feeling okay, and then I will hold onto the gait belt and walk to the opposite side, the unaffected side, where that device is being held. From there, I'm going to make sure that it's placed in the right position, and so I need to have that 2-4-6 rule in my mind. So I'm going to have the device to be at almost a 45-degree angle for my patient. From there, I'm going to look at the ulnar styloid process with the cane, the greater trochanter, and then also once they're holding onto the cane with a neutral wrist, that the elbow is going to be in about 20 degrees of flexion. If all of the landmarks are looking correct and I don't need to readjust, then I'm going to be very pleased with this because usually I have to readjust. And I will walk back to the right side, make sure that my patient, I'm holding onto their gait belt, place my hand on their trunk, and then tell them to just step back slightly, position that left foot, a little bit posterior and midline, and then come to seated using their hands to control the descent as needed. My patient needs to have their back all the way against the backrest of the chair. From there, I'm going to, have to readjust if I needed to, but if not, I'll proceed to the appropriate ambulation pattern, functional mobility pattern with this device. And for me, again, I said a 2-point modified pattern. So when I'm thinking about what that would look like and demonstrating that to my patient, I have to remember that the device is going to be unilateral and being held in the left hand. And I want to also always have the most normalized gait as possible. And so for a patient that does not have any weight-bearing restrictions, and I don't have any concern over balance, and I'm thinking about this device, that pattern would look like advancement of the device in the left hand with the right foot simultaneously, and then advancement of the left foot and the right upper extremity in a step-through pattern. So again, device and the affected lower extremity, unaffected lower extremity, and right arm. And so device, right leg, right arm in a step-through pattern. That's going to be my modified 2-point pattern. If for any reason I needed to turn with my patient, I would always be guarding on their affected side, holding onto the gait belt and with my hand on their trunk. I would tell them to turn towards me, and so I would not have to be caught in between any surfaces. And if my patient needed to back up, I would make sure that when they were backing up, that I tried to maintain that pattern. The 2-point modified is the one that I selected. And I would try to avoid backing up onto the affected leg first. And so it would look more of the right arm and the left lower extremity, and then the left upper extremity holding the assistive device, and the right lower extremity that's affected. So I'm still maintaining that pattern, but I'm just avoiding having to weight shift initially on the affected leg. So I'm always looking out for my patient. As I go through the rubric, I think I've been able to cover all of my bases. I did the functional mobility pattern. I was able to discuss the confirmation of fit. I talked about the sit to stand process. And so all that's left would be a clinical question from my grader if that was needed. Sometimes our grader might also need more clarification in the process since it's being performed virtually. But overall, the practical would be completed, and I would have been able to feel confident that I had provided enough information and that I had answered the necessary portions of the rubric, which would include the clinical judgment, the rationale, confirmation of fit, assistive device and mobility pattern selection, and functional mobility pattern itself, to give me a total of my points. Again, looking at the rubric, we want to make sure we have 80% pass, and so for a 60-point total, that would be 48% passing. And also, just thinking if there was anything else that my grader needed to ask, that they would be able to perform that before the completion of our meeting. Hopefully this is helpful and that you are going to be able to practice your own cases and describing that to your grader before we actually have our practical performances. But if you have any questions, bring them to our scheduled lab. I look forward to seeing you all, and I just thank you again for all of you being just so excellent during this time. And again, I miss seeing you in person, but I look forward to seeing you on Saturday virtually. Bye.